now let's go to the demonstration. So the question which I have to test, demonstrate, that is I have to check the distribution of the following parameters and compare their mean and median values at baseline and at the time of outcome, means at the time of discharge or death. So these are the 5 values: SpO2, CRP, bilirubin, urea, and creatinine. So I'll go to the Jamovi. There, I think I have moved this. Let me move this back. So you go to the, I have unchecked all this. So how will we go? There is an option of this t-test. Go to the t-test, paired sample t-test. Now I have to move. So you have to move 2 variables. This one is at the time of admission. Can you see these variables? So like this pulse rate 2, SpO2 is at the time of discharge, and this one is at the time of admission. So the paired value I have to move, that is the SpO2. So I'll move SpO2 1. And then I may move this SpO2 2 here. So can you see SpO2 2? So this is the SpO2 2. So I have moved here. So you can see it is the paired value 1 and 2. Again, the second variable is CRP. So you will move. So you have to move first CRP 1, then only CRP 2. Don't do like 2 and 1, 1 and 2. So that sequence should be there because it is the paired value. So you have to take first the first value. So CRP is here. So CRP 1 and then the CRP 2. So I will go down and see where is the CRP 2. Here is the CRP 2. The third pair is the bilirubin. So bilirubin, if I come up, it is here, bilirubin 1. And bilirubin 2 is here, bilirubin 2. Then the third is urea and fourth is creatinine. So if I focus on urea, you will see this is the urea. And this is the, let me see if I shift creatinine. So creatinine will come here. So again, I have to move it back because I thought maybe it will go to 1, but no. So urea, that paired value you have to shift. And this is urea 2. Again, come up creatinine 1 and creatinine 2. So now all pairs have been entered. Now, first I'll check for the normality. Because if it is not normal, then I have to do the Wilcoxin. Here you will see there are 2 options, student and Wilcoxin. There is no concept of variance here because it is the same population which has been tested twice. So these are not the 2 different groups. So now I will check this QQ plot, and this QQ plot, it tests for the difference. So you will see the QQ plot. This is very easy here. In SPSS, we had to create a new variable. That was the difference, and then we used to check it. So you can see here this SpO2 1 and SpO2 2 difference. This is normally distributed. This is again normally distributed. This is also normally distributed bilirubin. This seems to be normally, this creatinine is not normally distributed. So you can take a call of doing. So what I will do here, I'll move this creatinine maybe here because I have to apply the Wilcoxin here in this case of creatinine. And then once I've checked the normality, then what I'll do for the outlier, you can go and check with the exploration like we did before. Then you can check the mean difference, its confidence interval, the effect size, its confidence interval, descriptives, and then descriptive plots also you can do. So you will see up the mean difference. So you can see at the first statistics. In this case, if you focus on this p-value, then you can see this is the significance. So which variable are significance in this case? The pre-post. Can you type in the chat box? All. Yes, you are right. All are significant. Then mean difference is, you can see the mean difference. This says that whether the pre-value is more or the post value is more. And for that, you need to go to see this mean value. So this SpO2, you can see that after the SpO2 improved, in group 1 means like at the time of intervention, it was 94.25. And then it has increased to 95.4. So this means that it is giving you the 2 minus 1. No, sorry, 1 minus 2. Whatever is there first, this does this minus 2 means 1 minus 2. That's why it is coming negative. Otherwise, rest of them are positive because it has increased. Like CRP, it has decreased. So the mean difference is of 118. It is positive. Again, this is a positive and this is again a positive one. And all are significant. It's degree of freedom and T statistics. And depending on that, the value of T is negative here because it is the difference is negative here. And then you can see the effect size also. So the effect size, if you come here, this is the Cohen's value of effect size. This is the 95% confidence interval. So if you focus here on the 95% confidence interval, you can see that both are having the same sign. These two, this one and this one. That means it is significant. If you focus on the value of effect size, then you can see it is minus 0.160. So this is again, the effect size is not, it's very mild effect size. Although this was significant. So you can see here, this is 0.001, but its effect size is 1.15. And if you see the difference also, in this case, the difference, although the difference was of 118, and 118 was the value of the CRP. But clinically, according to this, this was not a very good effect size because the value of Cohen's D is only 1.15. Now you have to see the descriptive. So this is the mean. You have to report the mean and standard deviation. And then you can give these plot also, like this QQ plot and the descriptive plot. So if you have to write the interpretation for this, then again you have to include the assumption testing also. So this you have to write the pre-intervention mean values and standard deviation, post-intervention mean values and standard deviation. This is for one variable. Like if you have many variables and you want to do many paired t-tests, then you can write like pre and post-intervention and difference of mean also you can write. You have to give the value of t-value and interpretation. You have to write that the difference in the mean of this, in this case, it was the maybe the SpO2 or CRP, the dependent variable, it was normally distributed as found by the visual inspection of QQ plot. So you can write here, I have written the difference in mean level. Across this pre-post, it was significant. This was normally distributed as found by the QQ plot. There were n number of outliers or no outliers which were kept in the analysis. There's a significant increment or no, not increment in the mean value after the intervention. And the difference in mean was this with its 95% confidence interval. This way you have to write about the assumptions. And creatinine 2 here. And then I can...
Ma'am, voice is not coming.
Can you hear me now? I got disconnected.
Yes, ma'am.
Okay. So could you see this shifting of this creatinine 1 and 2? So I'll again tell you, we are
Ma'am,
now going.
can you repeat this thing
Yeah,
again?
I will repeat. So I'm repeating it again because we, in the first check, when we were doing the normality testing, we saw that creatinine was not normally distributed. So now I have to test creatinine separately for the Wilcoxon. So I'll move this back. So this was like this. Then again, I have removed all these things. I'll show you since beginning. So I'll go to this creatinine because I know now that creatinine is not normally distributed. So I'll shift this creatinine here and then shift this creatinine to its paired value. Assumption, this is not distributed. Is it okay now? Yes, I think I'm visible now. So now you have to click with this Wilcoxon rank. And this Wilcoxon rank, you have to check with the effect size and descriptives. Okay, am I audible now?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay. So I have clicked this Wilcoxon rank, then clicking the effect size, confidence interval. This is the descriptive. I have clicked the descriptives also. And then you can see here that the difference of this, in this case, you will not get the difference because here it is the, you can see it is the p-value which was significance, and this is the Wilcoxon statistics, value of Wilcoxon. And the effect size is, in this case, the effect size is not the Cohen's, rather it is the, because correlation is also one way of doing the effect size. So it is giving you the effect size of this by this rank by serial correlation. So you can forget this by serial correlation. Actually, by serial correlation, I did not tell you, maybe I mentioned it once, that we apply when there is a, there is a ordered, means that ordinal scale, we apply the biserial correlation. And in this case, when it is not normally distributed, it gives you the paired this effect size using the biserial correlation. And then you can see here the median value. So again, interquartile range, you have to go to the explore and you have to take out the interquartile range of the both the values. And then it's like you will go to the exploration, you will go to descriptive, you have to shift the this creatinine 1 here, 1 and 2 also. So this creatinine 2 I will shift here, and then in the statistics I'll uncheck this mean and I'll check this IQR. This I don't want. So you can have like median and IQR of serum creatinine 1 and serum creatinine 2. And this you have to write in the table, because if you see the table, it is the mean and interquartile range of the pre-intervention and the post-intervention, along with its value of the your Wilcoxon and p-value. So again, in this case, you will write assumption as the difference in the this dependent variable. It was not distributed normally across the pre and post intervention, as assessed by the visual inspection of QQ plot. There were many extreme and normal outlier, or there were no outlier as seen by the visual inspection of box plot. And Wilcoxon sign rank test, it showed that there is a significant change across the intervention, and you have to report the median. So you have to show that out of these many patients, these many shows the increased value, and the difference median and of the intervention was this much lower as compared to the pre-intervention. So this template you will get, and then you can replace this with your result. Similarly, we write about the Wilcoxon sign rank test. So anything which you want me to repeat, because it's a relatively very simple test. You only have to shift the paired values. So I'll go to this one where we did. So this you can do. Is it okay? Can we move to the breakout room, Shreyas? And please, it is requested from all mentors, please give them time. And if all of you, please share your screen. Even if you remain in the breakout room for like 15 more minutes, you should be there. But kindly share your screen and show all commands. It will not take much time. Like if there are 4 or 5. Yesterday we made 6 breakout room, but we got a feedback that in 1 or 2 breakout room, there were only 2 participants, and that too they have joined with their mobile. So the mentor has, he was sitting idle. So this time, that's why I thought maybe today we'll have less number of breakout room as the number of participants. But if you think that you need to practice, then we can increase the breakout room. What is your suggestion today also? Because if you're thinking that you cannot
increase the breakout room.
Okay, then Shreyas, you make the breakout room to 6. Because I want everyone to show theirs.
Yes, ma'am, but usually the people joining in the breakout rooms are only a couple of people, ma'am. So that
you
even the
okay. Anuradha,
so
you
that's why
were there in
we'll be opening 4 rooms.
Maybe you can see those of you who are joining with your mobile. How many of you are there who are joining with the mobile? Can you unmute and say your name? Then
from both the devices, computer as well as mobile.
Okay, Anuradha, I got your point. Anybody else who could not show the screen in the previous this thing? Like Rita, I can see Rita. Can you join through your laptop?
Ask Adira, because she was with
Okay, then Shreyas, for now you open. Okay, let's take a midway between 4 and 6. Open 5 breakout room, and then we'll go to the individual breakout room. We'll see if there are more number are needed. Then we'll open more breakout room. Right now, open 5.
Yes, ma'am.
Okay, is it possible now, Shreyas, to open 5?
Yes, ma'am. I think
okay.
Madam?
Are you saying something?
Yeah, can I ask the question, madam?
Yeah, please.
My query. So, the value of Cohen, what you have said is 1 was above 1, right? 1.0. So, that is it not very good effect size in the beginning?
No, up till 0.2, we say it is small.
Yes. In the beginning, we had above 1. So, is it not very high effect size?
See, above 1 can be anything. Like it can be 4, 5. But if you're talking above 1, no, it is. We mentioned it in fraction. Did I say that?
Okay.
Above 1. It is like maybe I think.
If you see ferritin, yeah. No. Sorry.
Let me
Cohen.
I'll apply this. Maybe independent sample we can see. Like I did with the smoking. So maybe smoker. And maybe we can see like SpO2 was there. There can be like maybe cortisol. Maybe just for example, 2 I have taken, and maybe the mean difference effect size, descriptives. Okay, so now you can see the Cohen. So it's in point actually. Can you see it's in fraction? It's not 1.
Okay.
So if it is like up till 0.2, that's why I was worried. 1 is very high actually. More than 0.5, we say that it is a very good effect size.
Okay, madam. Thank you.
Okay, welcome.